If you wake up 3+ times to pee at night, your body is telling you this. Every night, the same thing happens. You're sleeping peacefully when suddenly at 2:00 a.m., your eyes snap open. That familiar pressure in your bladder pulls you from sleep. You stumble through the darkness to the bathroom, trying not to wake your spouse. You finish, climb back into bed, and just as you're drifting off again, an hour later, it happens again, and again before sunrise. When morning finally comes, you feel like you haven't slept at all. You're exhausted, foggy, irritable. Most people think this is just part of getting older. I'm 65 now, this is normal, you tell yourself. Your friends say the same thing happens to them. Your spouse has learned to sleep through your nighttime trips. It becomes part of your routine, something you accept without question. But what if I told you that your body is desperately trying to send you a message? What if these nighttime interruptions aren't normal aging at all, but rather the first quiet warning sign of something serious happening deep inside your body? Right now, across America, more than 50 million adults over the age of 60 are waking up multiple times each night to urinate. That's nearly 70% of the senior population. And here's the shocking part. Medical research shows that fewer than 1 in 4 of these people ever mentions it to their doctor. They suffer in silence, losing sleep night after night, year after year, assuming it's just an inevitable part of growing old. But the medical community is now facing an uncomfortable truth backed by overwhelming scientific evidence. Frequent nighttime urination, which doctors call nocturia, is not just an inconvenience. It's often an early warning system, a red flag that something critical is happening with your heart, your kidneys, your hormones, or your metabolism. The stories doctors don't want you to ignore. Let me tell you about Susan. She was 67 years old, a retired elementary school teacher from Ohio. For 15 years, she'd been the picture of health consciousness. She walked 3 miles every morning, ate her vegetables, took her vitamins, and never missed her annual checkup. Her doctor always said her numbers looked good, blood pressure stable, cholesterol managed, blood sugar normal. From the outside, Susan was doing everything right. But there was one thing she never mentioned to her doctor. For the past 3 years, she'd been waking up at least 3 times every night to use the bathroom. Sometimes 4, sometimes 5. At first, it was just annoying. She'd cut back on drinking water in the evening. She made sure to use the bathroom right before bed. She even tried setting an alarm for midnight to preemptively empty her bladder, hoping it would give her a longer stretch of sleep afterward. Nothing worked. The fatigue crept in slowly, so gradually that Susan didn't really notice it happening. She started needing afternoon naps, something she'd never done before. Her memory seemed a bit foggy. When friends called to make plans, she often declined, preferring to stay home. Her husband noticed she seemed more withdrawn, less energetic. But Susan kept brushing it off. "I'm just getting older," she'd say. "This is what happens when you're almost 70. Then one morning, while getting dressed, Susan glanced down at her feet and noticed something strange. Her ankles were swollen. Not just a little puffy, they looked bloated tight. When she pressed her finger into the skin above her ankle bone, it left a deep indent that stayed there for several seconds. It looked like her body was retaining water, holding on to fluid it should have been releasing. That image stayed with her all day. She couldn't shake the feeling that something was genuinely wrong. When she finally mentioned it to her doctor during her next appointment, adding almost as an afterthought that she'd also been waking up constantly at night to urinate, her physician's expression changed. The casual friendliness shifted to focused concern. "How long has this been going on?" he asked. "The nighttime urination, how many times per night?" Susan felt a small flutter of anxiety. 3 or 4 times, every single night, for about 3 years now. Her doctor ordered an echocardiogram immediately. When the results came back, they confirmed what he'd suspected. Susan's heart wasn't pumping as efficiently as it should. The technical term was reduced ejection fraction, early-stage heart failure. Her heart muscle had weakened just enough that blood was backing up in her system, causing fluid to pool in her legs during the day. At night, when she lay down, gravity no longer held that fluid in her lower extremities. It redistributed throughout her body, and her kidneys worked overtime to process it, creating urine all night long. If Susan had waited another 6 months, another year, the damage could have been far more severe. But because she finally connected the dots between her swollen ankles and her disrupted sleep, she caught it early. Treatment began immediately, medications to help her heart pump more effectively, careful monitoring of her fluid intake, and lifestyle adjustments. Within 2 months, Susan was waking up only once per night. Her energy returned, the fog lifted, she felt like herself again. Susan's story is not unique. It's happening in homes across America right now, this very night. Thousands of people are waking up repeatedly, thinking it's normal, while their bodies are screaming for help. When your heart whispers in the night. Here's what most people don't understand about heart failure. The term itself sounds dramatic, catastrophic. People imagine someone clutching their chest, collapsing, ambulances with sirens wailing. But that's not how it usually happens, especially in the early stages. Heart failure often progresses quietly, subtly, showing up first in strange, seemingly unrelated symptoms. And one of the earliest, most consistent signs is nocturia. Your heart is a pump. That's its job, to push blood through your entire circulatory system, delivering oxygen and nutrients to every cell while removing waste products. When your heart muscle weakens even slightly, it can't move blood as efficiently as it once did. This causes a backup in the system. Blood flow slows, pressure builds, and fluid begins to leak out of your blood vessels into the surrounding tissue, particularly in your legs and feet, where gravity pulls it downward during the day. During your waking hours, when you're upright and moving around, this fluid accumulates in your lower body. Your ankles swell, your shoes feel tight by evening, your legs feel heavy, but you might not even notice these subtle changes, or you might attribute them to standing too long, eating too much salt, or just getting older. Then night comes, you lie down in bed, and suddenly gravity is no longer forcing all that fluid to stay in your legs. It redistributes throughout your body, flowing back into your bloodstream. Your kidneys, which are essentially sophisticated filters, detect this sudden increase in blood volume. Their response is automatic and immediate. They work to eliminate the excess fluid by producing more urine, lots more urine. And your bladder, which can only hold so much, sends you urgent signals throughout the night. Medical research published in the Journal of Cardiac Failure tracked over 5,000 patients with early-stage heart failure. What they found was striking. 84% of these patients reported frequent nighttime urination as one of their earliest symptoms, often appearing years before they experienced any chest discomfort, shortness of breath, or other classic heart failure signs. Even more importantly, those who ignored this symptom and delayed treatment had significantly worse outcomes than those who sought help early. But heart failure is just one piece of the puzzle. Your nighttime bathroom trips could be telling you something entirely different. The sugar connection. Nobody talks about. Robert was 71, a retired construction foreman from Texas. He'd built houses his entire adult life, working with his hands, staying physically active. He considered himself tough, resilient, not the type to complain about minor health issues. So when he started waking up 3 or 4 times every night to urinate, he didn't think much of it. Probably just my prostate, he told his wife. Every guy my age deals with this. But there were other things happening too. He was constantly thirsty. His mouth felt dry all the time, like he'd been eating cotton. He'd drink glass after glass of water, but within 30 minutes he'd feel thirsty again. He was also losing weight, which he actually felt good about at first, finally dropping those extra pounds, he joked. But he wasn't dieting. He wasn't exercising more. The weight was just falling off. His wife grew concerned. Something's not right, she kept saying. Please just go get checked out. Robert resisted for months. He hated doctors' offices, hated waiting rooms, hated the whole process. But one morning he woke up and couldn't see clearly. Everything looked blurry, unfocused, like he was looking through a dirty window. That scared him. That same day he made an appointment. The nurse took his blood sugar as part of the routine vitals check. When she looked at the meter, her eyes widened. "Sir, we need to do this again," she said. "The reading is very high." She tested him twice more. Each time, the number came back over 350 milligrams DL. Normal blood sugar is under 100. Robert had undiagnosed type 2 diabetes, and it had been damaging his body for quite possibly years. His doctor explained what was happening inside his body. When blood glucose levels rise too high, the kidneys attempt to remove the excess sugar by filtering it into urine. But sugar pulls water with it, a lot of water. This creates massive amounts of dilute urine that the body has to eliminate. The result is constant urination, especially at night when the body is trying to process everything you consume during the day. The thirst Robert felt was his body's desperate attempt to replace all the water being lost through excessive urination. The weight loss was his body literally wasting away, unable to properly use glucose for energy, burning through muscle and fat reserves instead. Diabetes doesn't just announce itself, it creeps in slowly, doing damage silently. High blood sugar damages blood vessels, particularly the tiny, delicate vessels in your eyes, kidneys, and nerves. Robert's blurred vision was an early sign of diabetic retinopathy. His kidneys were already showing signs of stress. If he'd waited longer, he could have faced permanent vision loss, kidney failure, nerve damage, heart disease, and stroke. But he caught it. Treatment began immediately. Medication to lower his blood sugar, dietary changes, regular monitoring. Within 3 weeks, Robert's nighttime bathroom trips dropped from 4 or 5 down to just 1. His thirst normalized. His vision cleared. The fog that had been clouding his mind lifted. He had energy again. According to the Centers for Disease Control and Prevention, over 8 million Americans have diabetes and don't even know it. They're walking around right now with dangerously high blood sugar, and many of them are experiencing nocturia as one of the first symptoms. But like Robert, they're attributing it to age, to their prostate, to drinking too much water before bed. They're missing the warning signs. The breathing problem that drowns you in urine? Margaret was 64, a retired nurse from Florida. You'd think someone with her medical background would have recognized the signs, but sometimes we're the worst at diagnosing ourselves. For 2 years, Margaret had been waking up constantly throughout the night, not just to urinate, but for other reasons too. She'd wake up gasping, feeling like she couldn't catch her breath. She'd wake up with headaches. She'd wake up with her heart racing. And yes, she'd wake up needing to use the bathroom, usually 4 or 5 times every night. Her husband mentioned that she snored loudly. Like a freight train, he said. Margaret laughed it off. Lots of people snore. What she didn't know was that her snoring would suddenly stop. For 10 seconds, 15 seconds, sometimes 20 seconds, she wouldn't breathe at all. Her husband would lie there in the dark, listening, waiting, concerned. Then suddenly she'd gasp, choke, and start breathing again. Margaret felt exhausted all the time. She'd fall asleep watching TV in the afternoon. She'd nod off reading a book. She had trouble concentrating, remembering things. Her mood had changed too. She felt irritable, depressed, not like herself. But she attributed all of this to poor sleep caused by her constant bathroom trips. She thought if she could just stop waking up to pee, everything else would improve. A friend finally convinced her to do a sleep study. The results shocked her. Margaret had severe obstructive sleep apnea. She was stopping breathing an average of 42 times per hour during sleep. Her oxygen levels were dropping dangerously low over and over all night long. Here's what was happening. When Margaret's airway collapsed during sleep, her oxygen levels plummeted. Her brain detected this crisis and triggered a stress response, releasing adrenaline and other hormones to jolt her awake just enough to restart breathing. But this stress response also signaled her heart to pump harder and faster. Her blood pressure spiked, and critically, her body released something called atrial natriuretic peptide, or ANP. ANP is a hormone that tells the kidneys we have too much fluid volume, dump it immediately. The kidneys respond by producing more urine. So even though Margaret wasn't drinking excess fluids, even though her kidneys were functioning normally, her sleep apnea was triggering a hormonal cascade that resulted in excessive nighttime urine production. After just 2 weeks of using a CPAP machine, a device that keeps her airway open during sleep, Margaret's life transformed. She was only waking up once per night now. Her morning headaches vanished. Her energy returned. Her mood stabilized. She felt sharper, clearer, more like the person she used to be, and all because she finally addressed the real problem, not just the symptom. Sleep apnea affects more than 22 million Americans, and at least 80% of moderate to severe cases remain undiagnosed. Among people over 60, the prevalence is even higher, and a significant percentage of these people are suffering from nocturia, never realizing that their breathing problem is causing their bladder problem. The prostate problem. Every man fears. For men over 60, there's another major player in the nocturia game, the prostate. David was 68, a retired accountant from Michigan. Like many men his age, he'd been experiencing gradual changes in his urinary habits for years. It started in his late 50s, a weaker stream, having to wait a bit longer to start urinating, feeling like his bladder never completely emptied. By his mid-60s, he was getting up 3 or 4 times every night. David assumed this was just part of being a man and getting older. Every guy he knew complained about the same thing. His friends joked about it on the golf course. "Welcome to the club," they'd say. "Wait till you're 70, it gets worse." So David accepted it, adapted to it, worked around it. He stopped drinking fluids after dinner. He planned his outings around bathroom access. He made sure to use the restroom before any car trip, no matter how short. But over time, things progressed. The nighttime wake-ups increased to 5 or 6 times. He started having urgency, sudden, overwhelming needs to urinate that gave him almost no warning. A few times he barely made it to the bathroom in time. He started experiencing hesitancy where he'd stand at the toilet for a full minute or more before his stream would start, and the stream itself had weakened to barely more than a dribble. David's wife finally insisted he see a doctor. The diagnosis was benign prostatic hyperplasia, or BPH, an enlarged prostate. It's incredibly common. By age 70, about 70% of men have some degree of prostate enlargement. The prostate gland sits directly below the bladder, wrapped around the urethra like a donut around a straw. As it grows, it squeezes the urethra, making it harder for urine to flow out. This means the bladder has to work harder to empty. Over time, the bladder muscle thickens and becomes less elastic. It holds less urine and becomes oversensitive, sending urgent signals to empty even when it's not very full. Additionally, when the prostate blocks normal urine flow, the bladder can't empty completely. There's always some residual urine left behind. This residual urine means the bladder fills up faster, triggering more frequent urination, especially at night when urine production naturally increases. David started medication, an alpha blocker that relaxes the smooth muscle in the prostate and bladder neck, making it easier to urinate. Within 3 weeks, he noticed a difference. His stream was stronger. He could empty his bladder more completely. And most importantly, his nighttime bathroom trips dropped from 6 times down to 2, sometimes just 1. His sleep improved dramatically. His quality of life transformed. Left untreated, an enlarged prostate doesn't just cause inconvenience. It can lead to urinary tract infections, bladder stones, bladder damage, and kidney damage. In severe cases, complete urinary retention can occur, where a person can't urinate at all, a medical emergency requiring immediate catheterization. The medication mistake that steals your sleep? Sometimes the cause of nocturia isn't a disease at all. Sometimes it's the very medications we take to stay healthy. Helen was 69, living in Arizona, managing her high blood pressure with a medication called a diuretic, commonly known as a water pill. Diuretics help lower blood pressure by reducing fluid volume in the body, making the heart's job easier. Helen's doctor prescribed the medication and told her to take it once daily, but he didn't specify when. So Helen, being a creature of habit, took it with her dinner every evening at 6 p.m. What she didn't realize was that diuretics typically work for about 6 to 8 hours after you take them. So by taking her pill at dinner, she was essentially programming her body to produce maximum urine output between midnight and 6 a.m. Every single night, Helen woke up at least 4 times to urinate. She felt exhausted, frustrated, irritable. She mentioned it to her doctor during a follow-up visit, and he immediately recognized the problem. Take your diuretic first thing in the morning, he advised. That way most of the fluid elimination happens during the day when you're awake and active. Helen made the switch. The very next night she slept through until 4 a.m. before waking once to use the bathroom. It was the best night's sleep she'd had in months. Within a week she was sleeping soundly most nights, waking only once if at all. Such a simple change, such a dramatic result. Diuretics aren't the only medications that can cause or worsen nocturia. Antidepressants, particularly SSRIs, can affect bladder control. Medications for Parkinson's disease can increase urination. Some blood pressure medications beyond diuretics can affect kidney function and urine production. Even over-the-counter medications containing caffeine, pain relievers, cold medicines can act as bladder irritants and diuretics. If you're taking multiple medications, which most seniors are, the combined effect can be significant. It's crucial to review all your medications with your doctor, including supplements and over-the-counter drugs, to identify anything that might be contributing to nighttime urination. What your doctor needs to know: if you're waking up 2 or more times every night to urinate, it's time to have a conversation with your doctor. Don't brush it off as normal aging. Don't accept it as inevitable. Bring it up. Be specific. Keep a bladder diary for a few days before your appointment. Record when you drink fluids, how much when you urinate, and approximately how much urine you produce. This information is incredibly valuable for diagnosis. Your doctor will likely ask detailed questions. How long has this been happening? How many times per night? How much urine do you produce each time? Do you have trouble starting your stream? Is it weak? Do you feel like your bladder empties completely? Are you excessively thirsty? Have you noticed any swelling in your legs or feet? Do you snore? Do you wake up gasping or with headaches? Depending on your answers and physical examination, your doctor may order several tests. A urinalysis can detect infections, blood, sugar, protein, or other abnormalities. Blood tests can evaluate kidney function, blood sugar levels, and electrolyte balance. A post-void residual test uses ultrasound to measure how much urine remains in your bladder after you urinate. If sleep apnea is suspected, a sleep study may be recommended. For men, a prostate-specific antigen PSA test and digital rectal exam can assess prostate health. An echocardiogram can evaluate heart function if heart failure is suspected. The key is getting to the root cause. Nocturia is almost never just old age. There's always a reason, and identifying that reason is the first step toward better sleep and better health. The real consequences of doing nothing? Here's what happens when you ignore nocturia and just accept it as your new normal. First, your sleep quality deteriorates. You never reach the deep restorative stages of sleep because you're constantly interrupted. This leads to daytime fatigue, difficulty concentrating, memory problems, mood changes, and increased risk of depression. Second, your risk of falls and injuries skyrockets. Getting up multiple times in the dark, half asleep, with potentially impaired balance due to medications or underlying health conditions, it's a recipe for disaster. Studies show that seniors who wake up 3 or more times per night to urinate have a 50% increased risk of falling. Falls in this age group often result in fractures, particularly hip fractures, which can lead to hospitalization, loss of independence, and even death. Third, whatever underlying condition is causing the nocturia continues to progress untreated. Heart failure worsens, diabetes damages your organs. Sleep apnea deprives your brain of oxygen. Prostate enlargement leads to bladder damage. The longer you wait, the harder it becomes to treat, and the more likely you are to experience serious complications. And finally, there's the quality of life issue. Constant sleep disruption affects everything: your energy, your mood, your relationships, your ability to enjoy activities. You start declining social invitations because you're too tired. You stop traveling because you're anxious about bathroom access. Your world gets smaller. Your body is talking. Will you listen? Every symptom is your body's way of communicating. A swollen ankle, excessive thirst, a weak urine stream, gasping for breath in the night. These aren't random occurrences. They're messages, warning signs, red flags telling you that something needs attention. Frequent nighttime urination is one of those messages. It might be your heart saying, "I'm struggling to keep up." It might be your pancreas saying, "I can't manage your blood sugar anymore." It might be your airway saying, "I keep collapsing while you sleep." It might be your prostate saying, "I'm blocking your plumbing." Whatever the message, it deserves to be heard. The people in these stories, Susan, Robert, Margaret, David, Helen, they all had one thing in common. They eventually listened, they took action, they sought help, and their lives improved dramatically because of it. Early detection, early treatment, better outcomes. It's that simple. So tonight, when you wake up for the third time to use the bathroom, ask yourself, what is my body trying to tell me? And more importantly, are you ready to listen? Don't wait, make the appointment, have the conversation, get the tests, because the only thing worse than waking up tired is waking up too late.